right, so in this video, I'm gonna walk you through how to tell if it actually is an adductor strain or a groin strain. Really, I'm gonna use this interchangeably throughout this video and through this course, this program. So what I'm gonna do is I'm gonna slide my short leg up here, okay? And what I'm gonna do, and you can follow along with this, feel free to pause the video. I'm going to come up and find my pelvic bone. So if you start just here and kind of slide your fingers upwards, you should feel that there's a point where it's hard, right? This is the pelvic bone, and more specifically, the pubic ramus or the pubic symphysis, which is kind of in the middle. And this is where most of your adductor muscles attach. Okay, so most of the time, if you've had an adductor or groin strain, the pain is going to be in this region along here, okay? And I shot this in 4K so that if you need to zoom in, you can. So the adductors, they all kind of run in this region. It's the inner thigh compartment. Now, if your pain is down here, it is possible that that could be like the hamstring component of the adductor magnus. But generally that's more hamstring related, and we'll get into why or how to differentiate between those. If your pain is up here, right, that's more of a quad type pain. If you've stumbled upon this course, this program, you probably read my article already about why your groin strain is taking forever to heal, so you probably narrowed it down quite a bit already. So it should be in this region. Now, if it goes up into the abdominal wall, that is called potentially athletic pubalgia. So what can happen is the fibers of the adductor and the fibers of the abdominals, those come together, and what will happen is there can actually be some tearing through that entire area. And that's why you might have, if it's severe enough, like mine was, you can have pain in your adductor all the way into your abdominal wall. It's really painful. Okay. So next thing, that's how to determine like the area. So if that's the area that is hurting, then that's one point of you're probably dealing with an adductor strain. Another point is if the mechanism of injury was playing hockey, sprinting, doing like lateral lunges or really far reaching with your leg, all of those can contribute to high forces going through the abdominals and through the inner thigh. And what can happen is you can overstrain that muscle. So this is generally due to a really high velocity movement. This can occur with long distance running as well, but it's more common in sprinters, hockey players, soccer, football, sports with a lot of sprinting involved. So that's a mechanism of injury that's really common. Now, it is possible that you also had like an overstretching injury where your leg got into a weird position and just like overstretched it. So that is possible too, but just keep in mind that again, the main mechanism of this happening is when you overuse that muscle group. And then finally, what I'm looking at when I'm evaluating somebody is, okay, if the pain is in the inner thigh and potentially up into the groin, like right at the attachment point where the adductors attach, and potentially up into the abdominal wall, if it is up there, then I'm going to test a few different movements. And those few different movements I will show you, and they're a little challenging to test on your own, but just bear with me here. So I'm going to adjust the camera and we'll get right to it. All right, first one that we're going to test is going to be sideline leg lifts, and it's going to be the leg that you're lying on. So let's say it's my right leg. I'm going to lie on my side here. My left leg is going to come up like this. It's of course easier if you're not doing this on a bench. And then you're just going to lift that leg up. Okay? So this is a test that I would do if you came in to see me as a patient. And if you're having a lot of discomfort when you're doing that without resistance, and you're having it in the inner thigh area, it's pretty clear to me if you have the other things that we talked about, the mechanism where it was like sprinting or soccer or whatever, and all of the discomfort is in this area and that movement recreates it, then I'm treating this like a groin strain. Sometimes that doesn't hurt though. So sometimes I will then have people do this, where you put your hands together and then you push in. So you should really feel your inner thighs. You might even be shaking when you're doing this. You might feel them really engaging there. And if that is the case, that's totally fine, that's normal, cramping. But with that, if you also have discomfort with that, and you have the other things that we talked about, then I'm gonna treat this like it's an adductor strain. Additionally, if you don't have any symptoms with either of those, what I might test next will be, the thing we'll test next is going to be a resisted side-lying leg raise. So you'll lie on your side again, just like we did before, but you're gonna add weight to it. So you can do that with a band, you can do that with an ankle weight, and just test it that way and try to push yourself to fatigue if possible. So going to 10 reps, 20 reps, however many it takes with the added weight, assuming that there's no additional pain with it. Now, if you have discomfort when you add weight, that means that this issue is load dependent, meaning that as you add more resistance, you have more symptoms. And this is the case with most people, so don't be surprised if that's how you present. Now, if you're a lucky one and you don't have any symptoms with that, congratulations. Your symptoms aren't as severe as a lot of people. So what I would actually have you do is a lunge with your front foot elevated or the affected leg elevated. And what that's gonna look like, I'm gonna grab this and get it set up, and I'm just gonna adjust the camera really quick. Okay, so with my affected leg up here, what I'm trying to do is I'm trying to get into really deep hip flexion on this side, and then I'm just coming up and down, okay? So the adductors, they work very hard when they are in this position. All right, so a few important points to note with that is you're probably gonna have symptoms with some of those. You can try modified Copenhagen's, and some split squats from an elevated surface to see if those also produce symptoms. But more than likely, if you're having symptoms in that area, the mechanism of injury is what we talked about, and it's reproducible, then it's probably a groin strain.